Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined via WebEx video conference by Senator Bill Frist, Chairman of Nashville Health and the COVID-19 Response Fund. Here to help answer your questions are Rob McCabe, Chairman of Pinnacle Financial Partners and the Nashville Area Chamber of Commerce, and Laura Hollingsworth, Senior Vice President and Chief Marketing Officer at Opry Entertainment Group, Ryman Hospitality Properties. As business leaders and members of the major Metro's Economic Restart Task Force, Mr. McCabe and Ms. Hollingsworth have joined us to field your questions about the business and hospitality industry. Dr. James Hildreth, President and CEO of Meharry Medical College, Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are also with us this morning. We will now begin with Mayor John Cooper.
Good morning, Nashville. Over the past week, the Tennessee Major Metro's Economic Restart Task Force has coordinated on setting out a phased public health and economic reopening plan to get our communities back to work safely. Now, each major metropolitan area will tailor their own plans. A reopening plan must balance public health practices with each unique region's need to have a safe plan to get us back to work, and with the goal to be consistent and fair. Now, I'm grateful to Nashville's representatives to the Economic Restart Task Force. That's Rob McCabe, Chairman of Pinnacle Financial Partners and the Nashville Area Chamber of Commerce, Laura Hollingsworth, Senior Vice President and Chief Marketing Officer at Ryman Hospitality Properties, Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force, and Dr. James Hildreth, President and CEO of Meharry Medical College. I want to thank Rob, Laura, and Dr. Hildreth for joining us this morning to help answer any questions that our local reporters and journalists might have. Now, this morning we're presenting a plan to reopen Nashville safely, which you can view online at covid19.nashville.gov. And as always, we want to hear from you. Each of the 4 phases in this public health framework, which Dr. Jahangir will discuss in more detail, contains clear metrics to determine when certain parts of our economy will reopen, includes triggers that could require us all to revert to an earlier phase of the plan to protect our community, and ensures that our area health providers do not become overwhelmed by a spike in COVID-19 cases. Every Nashvilleian feels an urge to return to business as normal. Many livelihoods depend on it. But everyone, business owners and employees and customers alike, should trust that places of business, schools, and all venues throughout Nashville are safe. Consumer confidence lies at the heart of our economy, and a safe rollout must be data-driven, not purely date-driven. This is essential to avoid a false start, which would simply prolong the economic effects of the coronavirus in Davidson County. Now, this is why we've worked closely with public health officials, business leaders, and community leaders in developing this framework to ensure that our business restart plan takes a measured approach in safely getting Nashvilleians back to work. While the onset of the coronavirus pandemic has been swift, learning how to live, work, learn, practice our faith, and spend our leisure time with the continued presence of the virus will take a great effort by our entire community. Until a vaccine is made available and 100% return to business as usual can be achieved, we will continue to learn important lessons together as we maintain social distancing protocols. These lessons and continued conversations with health officials, business leaders, faith leaders, educators, and other members of our community may further inform our plan to reopen our economy and leads to adjustments that meet our residents' needs. Now, we have seen a sharp spike in new COVID-19 cases in the last 24 hours. As we learned earlier this week, our public health department is responding and working closely with community partners to address confirmed clusters in our community. But it's your efforts that will largely determine the end of the safer at home order and a beginning to business as normal in Nashville. With a coordinated effort to flatten the curve of the coronavirus, we could enter phase 1 of our economic reopening plan in very, very early May, if we meet a number of clear benchmarks, including an acceptably stable or sustained decline in new COVID-19 cases over a 14-day period, adequate testing and PPE capacity for our region, a robust public health infrastructure to conduct contact tracing investigations throughout our community, and low transmission rates. Today's discussion is to get us ready for reopening when these 4 tests are met. That's why everyone must continue to remain at home whenever possible. Only leave your homes to run essential errands and wear face coverings when social distancing measures are difficult to maintain. Now, tonight is the first night of Ramadan, a month-long holiday that I know many Nashvillians traditionally celebrate in community, especially for evening meals and prayers. And I'm grateful to Nashville's Muslim faith leaders for the public health adjustments they've made during this time of fasting and reflection, and for encouraging worshipers throughout Davidson County to do the same. Let's work together to get the number of COVID-19 cases down throughout Davidson County and begin getting everyone back to work. Now, this morning, I want to welcome Senator Bill Frist, Chairman of Nashville Health and the COVID-19 Response Fund, who is here to discuss the good work of the fund in providing much-needed relief to Nashvillians facing hardships during this time. I'm grateful to Senator Frist's leadership of the Response Fund and both his past and ongoing efforts to strengthen our nation's pandemic response. I urge everyone to visit Metro's COVID-19 website and donate as you are able to the COVID-19 Response Fund by visiting covid19.nashville.gov. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. I'll now turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. We now have 2,144 confirmed cases with a total of 22 fatalities. That is an increase of 182 cases in the past 24 hours. That is the biggest increase in new cases in a single day here in Nashville. It's a reminder that we are not out of the woods yet. But remember, the last 2 days we had a much lower number of new cases, and so our 14-day trend is still stable. This is why we look at a 14-day trend among other metrics. We will not let a single good day or a single bad day in the number of new cases take us off course. There are an additional 1,839 cases in the surrounding counties, bringing the total for our region to nearly 4,000. Of the Davidson County cases, 1,046 are currently active cases, and 1,076 residents have recovered from the virus and have been cleared. As the mayor said, this morning we released the roadmap for reopening Nashville. Our plan spells out the rules of the reopening for our city. As we have said, this will be a data-driven and not a date-driven process. We're not focusing on just one metric. We're looking at different metrics to get to a better picture of the impact of the virus in our city. We're looking at metrics including transmission rates, the 14-day trend of new cases, the number of days it takes for active cases to double, contact tracing resources, testing capacity, PPE supply, and hospital capacity. Positive improvement or stability in these metrics for 14 days will trigger the next phase. If something worrisome presents in these metrics, we will slow the process down. In each phase, different areas of our economy will come back online. Furthermore, we will prepare to enter phase 1. Businesses will be asked to begin to plan for the protocols and procedures to prepare for the opening. Also, upon expiration of Governor Lee's executive order postponing medical, elective, and dental procedures, hospitals and dental clinics will begin to offer these services to lower-risk patients. In phase 1, retail businesses will open and restaurants will have dine-in services, all at half capacity. And added guidelines and restrictions on operations will be present. Employees will be screened daily to ensure that they are symptom-free, and they will be required to wear cloth face coverings. Other public gatherings will be limited to 10 people or less. Everyone out in public should wear a cloth mask, and if you are able, still work from home. In phase 2, businesses and restaurants can go to 3/4 capacity, again with certain guidelines. In addition, personal hygiene businesses like hair and nail salons will open, but only for appointments, no walk-ins, and limited to 10 people inside the building at one time. Playgrounds, tennis courts, and basketball courts will open. Other public gatherings, including worship services, will be limited to 50 people and with adherence to strict physical distancing protocols. In phase 3, businesses and restaurants will go to full capacity. In addition, bars and entertainment venues will open at half capacity, and gyms and fitness facilities will open. Other gatherings will be limited to 100, again with adherence to strict physical distancing protocols. And in phase 4, bars and entertainment venues will be at full capacity, and sport venues will open with adherence to physical distancing protocols and best practices. This is a quick overview of the plan. However, it gives you a framework on which we will open our city. If you would like to review the plan further, please go to our website, covid19.nashville.gov. I also want to update you on a developing situation. Metro Public Health Department officials, along with the Tennessee Department of Health, have responded to Trevecca Center, a subacute care and nursing facility, after reports of positive tests late Tuesday. 17 people there tested positive for COVID-19. Once alerted to the situation, contact tracing immediately began. Over the last 2 days, close to 300 people were tested. Now, this is a developing situation. We'll continue to work with the state on the investigation and keep you updated. As we reopen, we will face similar isolated incidents, and this is how public health will respond, by performing contact tracing quickly and responding immediately to a cluster of positive cases to contain the spread of this virus in our community. Finally, as we look towards reopening, we cannot lose sight of what we need to do now. For us to get to phase 1, we have to remain vigilant and fight the virus by staying at home, unless it's absolutely necessary. That way, we can start the reopening process sooner, and most importantly, we'll save life. Thank you so much for your help and support in Nashville. Together, we'll keep Nashville safe. Now I'd like to introduce Senator Bill Frist, Chairman of Nashville Health and the COVID-19 Response Task Force.
Thank you, Dr. Jahanger. I am proud to be with you today and proud to be serving as chair of the Greater Nashville COVID-19 Response Fund in partnership with United Way of Greater Nashville and Mayor Cooper. COVID-19 continues to impact our entire region, and the demands will be ongoing for months and months to come. So many of our neighbors have lost their jobs. They've seen reductions in hours or experiencing loss of income due to their closed establishments or canceled events. These are the restaurant workers, the hospitality industry workers. It's the gig economy folks. It's the small business owners, many of whom have never, ever accessed social services before. Now, the good news is that Middle Tennessee nonprofits are responding to the needs in remarkable and truly inspiring ways. It includes the offering of meals, housing, counseling, legal aid, and cash assistance. As of today, the COVID-19 Response Fund has raised more than $4 million, all from local foundations, from corporations and individuals throughout the community. Half of that has already been dispersed to the community, and these distributions will continue over the coming days and weeks and months. But in truth, we've barely touched the surface. Our partner agencies have a waiting list of more than 4,000 people right now who are looking for help, for paying their rent, for buying groceries, for finding childcare so that they can continue to work. Our nonprofits need more funding. They need more funding to support our neighbors who are in need of everything from crisis counseling to diapers. If you're able, please consider contributing any amount you can to help our neighbors who are in need today and during these unprecedented times. Every little bit helps. 100% of these funds will go to the nonprofits to help people in need. You can donate now at the NashvilleResponseFund.com. That's NashvilleResponseFund.com, one word. Every dollar counts and will make a meaningful difference in the life of someone who needs our help. Thank you.
Thank you, Senator Frist. We will now start the Q&A segment of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Chris Davis at News Channel 5. Chris.
Situation at the Tyson plant in Goodlettsville, I think we saw 129 active cases. Does the city need to intervene in that situation, and does the city even have the authority to do so?
I believe the question was about the Tyson plant, and you asked if the city needs to intervene. Dr. Caldwell.
Good morning. The Metro Public Health Department is continuing to investigate and monitor this cluster of COVID-19 cases associated with the Tyson plant in Goodlettsville. Right now, there are more than 120 cases that make up the cluster. The USDA, the CDC, Tennessee Department of Health, and our Nashville Department of Public Health are working directly with Tyson officials to mitigate the threat of this disease in the power plant of the operations. So the steps there including restricting visitor access, having one-way entrances and one-way exits, spacing out shift changes, making sure that all employees get their temperatures checked before they start their shift, making sure there are enhanced social distancing in all the work and break areas. The USDA has inspectors there full-time. I personally visited this facility yesterday with representatives from CDC and the Tennessee Department of Health. Also, in attendance there at the Tennessee Department of Health was our state epidemiologist, John Dunn. We were all impressed and satisfied with what we saw there. Now, we know disease transmission can occur at the plant, but I am satisfied that at this point they're doing everything they can so that disease transmission is minimized. What I am concerned about is when people leave the plant and go home and are in their communities. We are going to be working directly with all the different communities that make up these employees to assure that they're safe as they travel to and from work, that they're safe at home, and they're safe in their communities. So in answer to your question, do we have the authority to shut this plant down? Well, yes. The public health order that the Board of Health passed gives me the authority to shut them down. And at this point, in consultation with my colleagues at CDC and the Tennessee Department of Health, I do not feel that is necessary. What I feel is necessary that we continue to work with Tyson, to monitor them closely, to learn from best practices, and most importantly, to work with all the employees in their communities to assure that they're safe, not just at work, but wherever they go. Thanks.
Jeremy Finley, News 4.
Good morning. Thanks again for taking the calls and our questions. The question I have has to do with, first off, the logistics of this plan in terms of, will the Metro Health Department inspectors be now, when the phases begin to open, will they be routinely responding to complaints, or are they going to be rolling around the city looking to make sure that all of these things are being followed? Because I know right now it's complaint driven, but I wanted to see if it would switch to roving police officers or health inspectors to make sure that the phases are being followed. That's my first question. Second question is, there's been other cities like Los Angeles have implemented antibody testing to see the people's capacity for the virus. I wanted to see what plan Nashville has for antibodies and if that is something that is being discussed right now. Thank you.
Thanks, Jeremy. Dr. Jahangir.
Hey, thanks, Jeremy. Enforcement will continue as is. What we have right now, as you mentioned, is we have teams for public health, police, and others. They do respond to complaints, but there's also additional enforcement. If you remember when the Safer at Home was first placed out, Dr. Caldwell, along with Chief Anderson, had a way of going around and doing that. So that enforcement mechanism will be adjusted accordingly. Regarding question on antibodies, FDA hasn't really approved many antibody tests right now, right? So I don't think that I and Dr. Hildreth, who's in the room with me, and others, public health experts, don't believe antibody testing right now is what it needs to be to make sense for our community. At some point, antibody testing is critical. I agree with that, but where we stand today, that's not the case. What is important is to detect an invisible enemy, is to test, and the testing that makes sense is the PCR, the swab test that we're providing at our assessment centers as well as around the community. So somebody feels like they need a test, that nasal swab test is still the standard of care. Thank you.
Julia Palazzo at WKRN. Go ahead, Julia.
Thank you, Chris. Good morning. Thank you guys for releasing this information. My question's for Mayor Cooper. For families or individuals at home that finally got approved for unemployment and then their place of work will reopen in whichever phase it may be, if that relapse happens and their workplace has to close again, what's your message for those families and those people in limbo who are living paycheck to paycheck? Thank you.
Mayor Cooper.
Well, Julia, we're learning as we go. Obviously, a relapse would be a hardship too. Not to reopen is a hardship. So I think you just have to be phased, do one step at a time, and for people to understand that a relapse will put us all back where we are financially. But our obligation is, if the data permits, to get restarted as safely as possible with a phased approach so that we're able to hopefully go forward, continue to go forward. But if we have to go back, we will go back if there's a relapse in the disease, and people need to understand that. We're only going to be able to advance if we do social distancing techniques correctly and appropriately, and that's what we need to continue to learn from this, how to improve those techniques in every place of work. Thank you.
Tosin Fakile, News 4.
Good morning. I have two questions, and my questions are coming from the questions that people are asking me. Thank you for sending the data out quickly. So the first question is, I know we're not waiting on a date, but people keep asking me, so will the Safer at Home order be extended? Like, at what point in May? Like, I know we don't want to give a date, but people are trying to figure out, like, at what point, at what 14-day mark does this reopening start? And my second question is, to go from phase to phase, I just wanted clarification. I know we're looking at a 14-day trend, so are we assuming every 14 days, if things are good, we move on, or if things are bad in 14 days, we move back? I'm just trying to kind of get clarification in between phases.
Dr. Jahangir.
Tosin, thank you so much for your question. I want to highlight a few things. First of all, we're not looking at just one metric. So there's going to be many metrics that we're looking at. 14-day trend is one of them. Hospital capacity, doubling time. There's a PPE capacity. There's a bunch of things. So please don't get stuck on just one metric. One may be good, one may not be as great, but if we, as using judgment calls, feel that we're good, we'll keep progressing and also regressing. Regarding the 14-day, our current stay-at-home order that the mayor announced and Dr. Caldwell has signed, it goes to May 1. Around May 1, we'll look at the data, and if the data, looking at the rolling 14 days, so if you're speaking about your 14-day thing, if 14 days from May 1 back looks positive, as well as these other things I mentioned, hospital capacity, doubling time, if those metrics all look stable, then we may initiate this as early as the very beginning of May. Now, if May 1, things are not looking as stable or as good as we currently are, then we need to reevaluate this, and we're going to commit to transparency as we have from the very beginning of this crisis to you. So there you go. Thanks.
Kara Hartnett with the Nashville Post.
Hi, thank you. My question is for Dr. Jahangir. Of all the metrics you were just talking about and you're looking at now, can you tell us which ones are not stable for reopening right now?
Thanks, Kara. Dr. Jahangir.
Yeah, so I'm really very, again, transparency here. For the most part, all of them are pretty good. Having 180 cases in one day doesn't help our 14-day trend, but the great thing is we've had low numbers the past many days. And so our 14-day trend, I looked at it this morning, is still stable even with 180 cases in one day. Now, if we have another 180 tomorrow, another 180 the day after, that 14-day trend becomes a problem. But as of right now, I think all the metrics we mentioned are pretty much, if you want to use red, yellow, and green, most of them, if not all of them, are green and maybe one or two yellow. So right now we're looking good, but Nashville, I need your help. Please continue doing the things that you're doing. Please be smart. Stay at home if you need to stay at home, which everyone essentially should if you can, and wear a cloth mask. So right now, we're looking pretty good, even with the 180 cases I mentioned. Thank you.
Harriet Wallace at Fox 17. You're on the air, Harriet.
Good morning. I have two questions. My first question is for Mayor Cooper. I understand that you all have taken great caution in deciding when to reopen, but I'd like for you to speak to there not being a clear defined date yet. Many people, some who I spoke with, getting migraines now because of the stress of not having money, the stress of not knowing when or if they can keep their homes, get back to normal life. Can you speak to or share any words to them about just not giving them a clear date yet? My second question, I've spoken with medical experts who say if we reopen too soon, we will see a spike, and 2 weeks from now, 1 week from now is not soon enough. Can you all please offer insight in terms of how you all are weighing your decision, knowing that experts are saying, hold off, not yet? Thank you.
Mayor Cooper.
Well, our process is deeply informed by public health expertise. And particularly on the Major Metros Restart Committee, you've got Dr. Hildreth and Dr. Jahangir. So in terms of a caution of not doing it too soon, oh, yes, we are cautious about not doing it too soon. Now, in terms of it would be easier to have a date certain, yes, it would be easier to have a date certain, but it may not be safe on that date. You may not be where you need to be in terms of the disease to be able to do it safely, and then you definitely reopened too soon. So I know it is an additional hardship in the community, but that is what medical practice requires. You can't pretend that you've got a good outcome of a test until you have a good outcome of a test. And in terms of, I think I want to reiterate Dr. Jahangir's point, most of our data-driven signals are in good shape, but not if we relapse prematurely on social distancing and you begin to develop a lot of cases and our transmission rates go up. A lot of things that the government can do, capacity, testing, PPE, social contacting, are going to be in place for as early a restart as possible. The trick will be, is our case, is the path of the disease in the community in good enough shape to do that? So let's get busy and spend the next week being super careful in social distancing now more than ever so that we can qualify to get to the next phase.
Nancy Ammons at News 4. Go ahead, Nancy.
Hi. Thank you for taking my question. I have two questions. Number one, I'm reading over the phase one reopening, and I'm seeing that businesses and industries that will reopen are required to screen daily all employees with temperature and respiratory system checks, and employees with a temperature of 100.4 degrees have to leave. Can you talk more about how employers will be doing that? Are they all going to have thermometers? Is there going to be training for that? The second question I have is, you saw the big jump in numbers. Is some of that attributed to the out-of-county screenings that went on over the weekend? Are you just now getting those numbers? Is that part of why you saw that increase? Thank you.
All right, Dr. Jungir.
So regarding business, I'll tell you the public health standpoint will be, we had industry look at, let me step back. So the public health way of screening is as we said, we're going to teach people about the symptoms. We're going to ask people to take temperatures. In a minute, I'm going to have actually Mr. McCabe kind of maybe come talk about how they thought about industry and speak from the industry standpoint. Regarding the increase in cases, some of it could have been that. The fact that our own assessment centers just yesterday did about 162 cases or 62 tests, and while those may not be reflective in today's numbers, we also did 800-something tests on Monday, and on Friday we did a bunch of tests. So there's just more testing happening in our community. Why those numbers come from? There's not one specific cluster that we could identify and say it's this community or it's this location. Just a lot of numbers. So there is increased testing in our community, but I can't tell you with certainty that's the reason we see the increased numbers. And Mr. McCabe.
Yes, thank you, Alex. I'll just say that all of the businesses, and I'm very active in the retail and commercial business units within the city, they're already preparing for reopening. They have their own protocols, their own sense of safety measures that are appropriate for their employees and their customers, so they have active plans. I think the good thing about our phased plan here that the mayor has presented is that all sectors get to participate in phase one. It's more like a rheostat or a dimmer switch. And you get to open at a certain percentage of capacity and we determine whether we maintain these safety precautions before we advance to phase two. So everybody gets to participate. I deal with the restaurant and bar community downtown. These are very responsible people that are interested in the safety of their associates, the safety of their employees, and the good experience of their client, and manage their reputation. So this is a collaborative effort. It's not just taking this document that's been presented today and people trying to implement it. The business community is well advanced in preparation.
Our last question is from Ian Jung at the Tennessean.
Hi, good morning. I want to start with a logistical question. I was curious if there's anything preventing the city from, extending the order indefinitely and lifting when they feel the need to do that. And second, I understand that there are several benchmarks and metrics that we're looking at when we talk about reopening. But as part of the 14-day trend, I'm curious if you can explain if you're looking at that as a whole on kind of how the cases look, or if, say, one day is high, like today, the clock starts over. Curious if you can explain how you see that being a stable situation right now when we had a huge spike today and this weekend.
Thanks, Ian. Dr. Jungir.
Thank you. Excuse me. In regards to why just not indefinitely put an order in place, I mean, I think we, as a task force, Mayor Cooper, as the mayor of the city, our Caldwell, I mean, listen, all of us want to be back to our daily lives as much as possible, right? So I think you can't just say we're going to just shut things down. But I'm really proud of the fact that we were one of the first cities, definitely in the state, but maybe even around the country, I really put in these orders quickly. And that's why we're in a place now, as evidenced by the data that I've mentioned earlier, that allows us to be in a place that maybe as early as the beginning of May, we can start lifting some of the restrictions. And regarding the statistics of, notice I said the trend of the cases. And again, I want to highlight, it's not just one metric we're following here. It's not just a 14-day trend. It's all these metrics. But the reason we put the trend and not a downward of cases period is because you'll have days like yesterday where we had 20-something, and the day before we had 30-something, and then you have a day like today where you have 180. What you really have to look at is how's that impacting our community at over a 14-day period. And as long as our average and the rolling average and it goes downward, we're at a stable place. Our hospitals can tolerate new patients. Our residents in our city aren't being horribly overburdened by illness. The contamination rate for one person transmitting a rate to someone else is hopefully less than 1. So that's why not one point in time is going to determine if we go up or down. It's really looking at the trend over the 14 days. And the reason 14 days was picked is because that's the general timeline of this virus. So within 14 days, you're either going to recover from the virus, you're going to show symptoms, or you're going to pass away. And so that's why 14 days is not an arbitrary number either. So I hope that answers it. And Mr. McCabe, I want to call him up here as well. Thank you.
Thank you. I'd just like to put from the chamber standpoint, a couple of numbers out there. This administration is committed to reopening. There's no question about it, but it has to reopen responsibly and on a measured basis. But for example, if we have a May 1st start, the estimate of the permanent job loss in our MSA is about 24 to 25,000 jobs. So that is a serious item. The later the start, the bigger that number gets. 24,000 jobs is 2.4% of the labor force. We're looking at a 9 to 12% unemployment rate, and more importantly, $1.6 billion of lost personal income. So there is an economic imperative to get started. But if it's not safe, if it can't be sustainable, those numbers will become even greater. If we start May 1st, we probably won't get back to the economic break-even for a full 12 to 18 months. So there is urgency to get started, but these protocols really govern when we can do that.
Thank you, Mr. McCabe. And with some closing remarks, we'll turn it back over to Senator Bill Frist.
Thank you. And I had the opportunity to look at the plan, and let me just say I'm very, very impressed. I'm spending a fair amount of time at the federal level and at the state level, and this plan that the mayor is putting forward, it integrates really in a almost pitch-perfect way with these larger frameworks, recognizing that the virus really does attack locally, and how we handle it locally ultimately determines and is the most important thing, both from an economic standpoint, but also from a public health standpoint. You know, this virus itself is different than any virus I've dealt with, and personally it's been HIV and SARS and other microorganisms like anthrax personally. And the difference is that this virus infects people when you're asymptomatic, and thus all the emphasis that Dr. Jahangir is talking about in terms of testing is critical. As I look at the plan, and now I've read it in detail, I want to affirm, endorse, as a physician, as a former policymaker, as someone who spent full time on this virus the last 6 weeks, the mayor's plan to reopen Nashville is smart. It is stepwise. I love the full transparency, both in these press conferences, but also in the plan itself. And then also that it's built on the very best science. And part of the humility of being a policymaker and a scientist, and that we all need to display, is that the science, we have a lot of unanswered questions. Science and the virus is changing daily, and it's evolving daily. And this plan, because it's built on data and it's built on science, recognizes that. And to me, that is critically important. And I know the uncertainty is tough, and it requires a lot of patience by the people of Nashville and people of Tennessee and people across the country. But the science just is different, and we're learning from it in a very quick way. The phased-in part of the approach You know, a lot of people say we need a certain date, as we just talked about. And with the lack of predictability, we don't know what's called the immunogenicity of this virus. We don't know if once you've had it, are you truly going to be immune, or for how long? We don't know if we're going to ever really have a vaccine, but we know these antiviral agents will be coming. There's just a lot of uncertainty out there, and having a phased-in approach with the percentages given, and I know it's going to be difficult for people to meet and understand, and there'll be a lot of questioning of the percentages, but it's a smart and best-in-class way of doing it. This prospective science, I think, is important for the reasons that I've said. That are we immune to this virus if we haven't had it? The answer is no. This is sort of the first virus I've seen where we have no natural immunity to it, and it's a deadly virus. So science is critical. The data, the metrics are important, and they are clear-cut metrics that are outlined in the plan that follow the disease course and one's ability to respond to it. There are parts in there that talk about the capacity and the hospital capacity, and if we do have a surge, can we handle it? And we need 2 weeks of supplies, and all of that's built into the plan. And it's clear, and I think we as a citizenry of our community need to understand that this is going to go on for months, not just the economic recovery, but a vaccine may not even be out there in 18 months. We don't know when the antivirals are going to come. So it's going to be like an accordion. And in all likelihood, as we open up a little bit, we're going to learn a lot. And there will be times where we have to tighten it up when we have a surge of this virus. The virus is cagey and it doesn't stop. And it's not going to stop, and it's not going to pause for us. So it's going to be like an accordion, opening a little bit, closing a little bit, opening a little bit more until we can gradually open. And lastly, and is that both the mayor and Dr. Jahangir have said, we do need a lot more testing. And ultimately, at the end of the day, this greatly expanded testing will allow us, each of us, to know, are we still susceptible to this virus? You know, we haven't had it in the past. That's one class. The second class is going to be that, yes, we've had the virus, but we don't really know how long we're going to stay immune and not be infectious and can go back to work. But we'll figure that out, and that's why those serology tests. And then the third class is that I have the virus now. I may not have symptoms, but that's going to be very important for people in nursing homes and people in assisted living and people in hospitals, those asymptomatic people. And I close with that just because the report itself and the plan itself calls for this greatly expanded testing and what's called contact tracing over time. And that's going to take a couple of weeks to build up, I believe. But again, the transparency in the plan is just that. So in closing, I think the plan is right where it should be in terms of science. I do want to endorse it where we are today. It's scientifically based, and want to affirm what has been laid out today. Thank you.
Thank you, Senator Frist. We're tremendously grateful for your support and again for your leadership of the Greater Nashville COVID-19 Response Fund. And a special thanks to Mr. Rob McCabe and Ms. Laura Hollingsworth of the Tennessee Major Metro's Economic Restart Task Force for joining us this morning. There are no more media questions in the WebEx queue at this time. A recording of this press briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.